My name is Dr. Kilcup, and you are watching a video about when a sinus problem can be caused by an intestinal problem. Our story is about a young lady in her early 30s, very busy mom, having a job and 2 kids under 5. She has come because she's struggled with sinus issues for 17 years. She also has migraines every week. For the past 15 years, she has to treat those with medication. She suffers with PMS and bloating. For the past 4 years, she's had terrible heartburn. And she's had a long-term problem with acne, and it's been treated with antibiotics and an antibiotic cream over the years. She also reports that she suffered from bloating and diarrhea during her teenage years after several trips to Mexico. And in addition, she suffered from yeast infections 1 to 2 times a year as a teenager, and those are treated with antifungal medications. So as a functional medicine doctor, I look at the history for clues as to what's going on. Why does this person have sinus trouble? I'm not going to treat the symptom. I'm not going to treat the disease. I'm going to look for the underlying causes that produced it. So in this situation, the clues that I pulled out of the history was that there has been a lot of antibiotic and antifungal medications used on this patient over the years. The other thing is I hear about heartburn, acid reflux for the past 4 years. And the last thing is that we have bloating and diarrhea. So all of these things point to problems in the intestines, in the gut. So once we get the history and we need to find out if in fact what we think is true, we run some tests. So we ran some standard blood tests. We ran a leaky gut test. If you don't know what leaky gut is, there's an article on the website that describes it pretty well. We did a comprehensive stool analysis. We did food sensitivity testing. And the results of those tests were as follows. The blood test showed that this patient was deficient in vitamin D, and she had low magnesium, zinc, and B12 levels. The leaky gut test was positive, and the comprehensive stool analysis showed that she had many harmful microbes. She had candida, and she didn't have enough of the healthy microbes. And finally, the food sensitivity test showed that she had many sensitivities to different foods. So, what happened here? What does all this mean? How does all this end up causing sinus problems? The drugs that were used to treat the acne and the yeast infections created an imbalance in the normal healthy microbes, and that led to leaky gut. Those medications killed off all the healthy microbes and as a result, unhealthy microbes that damaged the lining of the gut were allowed to go unchecked. Now, once you have a leaky gut, proteins from food get into the blood that shouldn't be there. They're too big. These have not been digested into small enough pieces. These large foreign proteins in the blood result in allergic reactions that can cause food allergies, sinusitis, migraines, fatigue, a whole host of things that can result once we have the leaky gut. And we can see some connection here with our patient. She's got food allergies, sinusitis, and migraines. So what do? We treated the candida and the bad microbes with nutraceuticals. We knew what would work to eradicate these infections because the tests that we ran treated the bad microbes and the candida to find out what would work. We then used pre and probiotics, the good bugs that she needs. We used nutraceuticals to heal the leaky gut. We eliminated the foods that the patient was sensitive to. We use a digestive aid because of her heartburn, her acid reflux. Actually, the way to fix that in most cases is to use a digestive aid. There's an article on the website about acid reflux if you're curious. We also give the patient vitamin B or D, B12, magnesium, and zinc. Here's what happened. 1 month follow-up, the patient's migraines had improved. She wasn't having them as often, and they were not as intense, and she didn't need to use the meds anymore. The sinus congestion had improved by 50%. The heartburn and bloating were gone, and her energy was improved. In 2 months, we see the migraines and the sinuses continuing to improve. This time, she reports that her acne is beginning to improve as well, and that her PMS is much better. 4-month follow-up, the migraines are almost gone, the sinus congestion is almost gone, the acne continues to improve, the PMS continues to improve, and the energy again is improving. Well, those are really good outcomes. So here's the big takeaways from this story. The first one is that migraines can be caused by the gut serotonin connection that is disrupted when the gut is not healthy. You see, 90% of the serotonin in the body is made in the gut. So when people are having migraines or depression, as a functional medicine doctor, I want to know if that gut is healthy, because if it's not healthy, they're not going to have enough serotonin. So rather than use medications that cross the blood-brain barrier and interfere with the normal reuptake of serotonin, why not just fix the source of the problem and get the serotonin produced in the gut like it's supposed to? Sinusitis can be caused by internal allergens that result from a leaky gut. Whenever sinusitis happens, we always think of external allergens like pollen, or an allergy to a perfume, or a sinus infection. And these are all valid causes of sinusitis, but in the absence of those causes, we need to look for other things, and these internal allergens are often a source of sinusitis. Acne can be caused from the disruption of the immune system that a leaky gut can produce. Those proteins that get through the gut into the bloodstream begin to activate the immune system in a way that it begins to turn on itself. And acne is one of the things that can happen when we see that happening. PMS can result from hormone production and metabolism that's disrupted when a gut is dysfunctional and vitamin D levels are low. Well, this patient had very low vitamin D levels, and when the gut doesn't work right, hormones and the metabolism are not going to work right as well. So PMS is something that oftentimes results from these kind of problems. And the last big takeaway is that energy, low energy, can be caused by the lacking of proper nutrients that are required for proper metabolism. So in this patient's case, the magnesium, the zinc, and the B12 weren't there in sufficient amounts for her metabolism to work right. We see this a lot with chronic fatigue patients. And this is often a result of a leaky gut, because when the gut absorption mechanisms aren't working correctly, they're not going to have certain nutrients that they need. So I hope you enjoyed this video. You can read more on my website, and if you have any questions, you can put those in the comment section. I'd prefer on my website, but you can also do it here if you're just looking at this on YouTube. So I hope you have a great day. I hope this helps. Bye-bye.